Welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Welcome to another episode of We Talk Health. My name is Will Kwasigroh, and there are quite a few people in the studio today to talk about mammography, specifically about self-referral and the new self-referral policy that has been put into place at West Tennessee Imaging Center here in Jackson, Tennessee. Now, typically, I would be hosting. Today's subject is about mammography, and being a man, I don't have any say in that. Joining me today on the podcast is Sarah Staley. She is going to be co-hosting. Sarah, tell me a little bit about yourself.
Hi everyone, I'm Sarah Staley. I've been with West Tennessee Healthcare since August, and I am the West Tennessee Medical Group brand specialist, and I'm going to be talking with you guys today.
Well, welcome. I'm glad you're here.
Thank you.
Joining us in the studio is Ms. Tamara Hickerson, Dr. Adam Summerlin, Paula Shackelford, and Ms. Sheree Eason. How's it going? How are y'all today?
We're good.
Well,
Wonderful. Good. Thanks for coming in. And Sarah, how are you?
I'm good.
Good. I'm actually going to hop over and give Sarah the mic now. So like I said, we're going to be talking about self-referral policy that's changed in the West Tennessee healthcare system. We'll kind of go to it from there.
Hi everyone, it's Sarah. I'm taking over today for Will, and so I'm just going to ask everyone if we'd go around and introduce ourselves, and we will start with Tamara.
I'm Tamara Hickerson. I'm the manager in radiology. I'm at the imaging center and over mammography as well.
Hi, my name is Adam Summerlin. I'm a radiologist here in Jackson, Tennessee. Been here for about 7 years. I am the medical director and help lead up the mammography and women's imaging service line.
Hi, my name's Paula Shackelford, and I am a registered nurse, and I'm also the breast health nurse navigator at the West Tennessee Imaging Center. And I've been with West Tennessee Healthcare for 40 years. And
That's amazing.
Yeah, and I get to talk to women all day.
Oh, yes. Okay, we're going to go to Sheree next.
Hi, I'm Sheree Eason. I'm the Mammography Supervisor for the West Tennessee Imaging Center. I've been with West Tennessee Healthcare. I started my 28th year in October.
Perfect. Okay, so we're going to start with our first question, and that's what's new in 2022 with West Tennessee Healthcare mammogram departments?
Well, we're excited. We started a new policy to where we accept self-referred patients, and we also accept self-requesting. So what that means is women can now initiate and make their own screening appointments, and they can do it at a convenient time for themselves without having to have a doctor's order or having to see their doctor first and bring us an order.
So the goal of this is to increase screening mammography rates all across the system. Our mammography referral rates are fairly low. And one of the barriers is a lot of times women are busy leading families or working outside the home, and those things make it hard sometimes for women to put themselves first and get the care that they need and deserve. And so having to have a doctor's appointment and get an order and then schedule something. So one of the goals with this was for women to be able to take control of that. And, you know, all you need is a free 30 minutes or 45 minutes, and you can swing by the imaging center, walk in, fill out some paperwork, get your screening mammogram, and be on your way. And so that should be a real benefit in increasing access for women across the system who qualify for mammograms. And we'll talk a little bit more about who that is.
What is the difference between a self-referred and self-requested patient?
So a self-referred patient is someone who hasn't seen a healthcare provider probably in 3+ years, or they're not an established patient with any provider, so they don't have anybody who could have written them an order. And a lot of times that would deter them from coming and getting their mammograms. So now we're encouraging them who don't have providers to come in or call and schedule their screening mammogram. And if they need a healthcare provider for just regular other screening exams, we can give them a list that are in our area and try to connect them with a provider, because there's a lot of other preventative care that they're missing out on besides just screening mammograms. So it's just a way for us to connect with them. If they're not established patients with a provider, then a self-requesting is they have a provider. They have someone they probably go see every year or every other year, but they can still make their appointments and come in and have their screening mammogram without an order. And we'll just make sure we fax that report to their provider or their physician of choice.
How do patients get scheduled for a self-screening mammogram?
They call our centralized scheduling line. It's 731-541-8303. And they can just tell them, hey, I want to schedule my screening mammogram. They can only have one screening mammogram a year, so it needs to be close to 12 months, if not 12 months, from when they had their last screening mammogram to get the best quality and get the best results. But they can call that number and just tell them who their healthcare provider is if they have one. And if they don't have one and haven't seen one in the last 3 years, just let us know you're a self-referral, and we'll get them taken care of as well when they come in for their mammogram.
That's wonderful. What is a screening mammogram?
I'll start with maybe the big picture, and then you can fill in with what a woman's going to experience when they come in. So when women come in for a screening mammogram, they'll have to fill out a little sheet. And the goal of that sheet is to collect some data and that sort of stuff on the patient, because our screening population of women, those patients who are 40 years and up, and they get a screening exam once a year, they can't be having any problems related to the breast. So no pain, no nipple discharge, no palpable abnormalities where they're feeling something. Any woman who has a problem with their breast, something that they want evaluated, they need to see a doctor and have an exam and get an order and come for what's called a diagnostic evaluation. For screening mammograms, these are asymptomatic women with no complaints who are 40 and up. When they get scheduled, as we talked about, they'll get an appointment time and come in, and then they will see one of our lovely mammographers who will take them through that process.
In the mammogram, typically it's 2 images on each breast. People get in their mind that it's not a painful thing. It's not comfortable, but it is not painful. Probably from check-in to leaving, if it's a screener, 25 minutes would be tops. So we all have time to make time for ourselves.
Definitely. Who should have a screening mammogram and when?
Yeah, so to expand on that, there's been a little bit of discussion nationally in terms of what the guidelines are. The guidelines produced by all of the clinically oriented care providing services like the ACR, the Society of Breast Imaging, Society of Breast Surgeons, all recommend beginning screening mammography at age 40. There are some caveats to that. So there are women in the community who have a strong family history of breast cancer, and those women might need additional or supplemental screening. They might need to start earlier. So those patients with a family history, it would be great to talk to your provider and have an established patient-physician relationship and go to that resource to sort of evaluate your risk. But for the general screening population, starting at age 40, screening mammograms are recommended once a year. There's not a hard cutoff on the end of that. That's a discussion that we can have, or a patient can have with their provider individually to determine how long they should continue screening. And we find that the most life years are saved by starting at age 40 compared to starting later, and that more life years are saved by doing annual screening mammograms as opposed to skipping and doing every other year. I know that's easier for some patients in terms of scheduling and being able to get in just once every other year, but seeing these changes in the breast evolve over time from year to year is one of the things that really helps us to detect breast cancer earlier. So when we talk about screening mammography, the point of screening is to catch women before they develop problems, to catch cancer when it's treatable. And especially in younger women, those cancers are the ones that are going to shorten lives and cause more long-term repercussions. And so that screening mammography starting at age 40 is really important and gives us the best chance to catch things when they're small and when there's lots of treatment options, instead of waiting until a woman feels something in their breast or has some other change. And detecting those late-stage cancers, there are much fewer treatment options and the outcomes just aren't as good.
If women have questions or want to schedule an appointment, what is the best way that they can do that?
If they have questions, they can always reach out to me. I'm a point of contact for anybody who has a question about screening, mammograms, or even diagnostic. And my number is 731-541-8875. and I have a voicemail. They can leave me a message. They can contact their own physicians if they have questions, like Dr. Summerlin said, concerns, something going on. Definitely contact your healthcare provider. Our goal and our hope is, with all this going on with COVID, people have put themselves on the back burner. They didn't have their screening mammograms, and therefore, unfortunately, we're going to see a lot more cancers as time goes on. But now we want everybody to get back to their screening, preventative care, and to call and schedule that screening mammogram at our number, 731-541-8303, and then get them back on their track. And by dropping the need for an order or the need to go see your physician first so you can get your order, we're hoping that opens it up to them for their convenience, their flexibility to get in there whenever, we do them during lunchtime. So we can get those, and we have late afternoon after the kids get out of school appointments, and early morning. And we have several locations. I mean, this is throughout West Tennessee Healthcare. All of our mammography departments are doing this. So they can, someone in Milan, you call there, or Bolivar or anywhere else, and get something close to you so you can get in there and get that screening every year. Makes a difference.
Definitely. That's going to be very convenient for all of West Tennessee.
Well, thank y'all so much for coming in today.
y'all.
Sarah, thanks so much for co-hosting. I really appreciate it. I interviewed a doctor the other day, and he said, if you don't make time for your health, you will have to make time for your sickness. And I think this is a really strong way of saying you have to get your mammograms done if you're a certain age, or you very likely could have issues down the road that you don't even know about at the time. So thank you all for coming in today and talking about it. I really appreciate it. All the phone numbers that you mentioned, the office number and Paula's phone number, are going to be listed in the description of the podcast. So listeners, if you're listening and you're trying to find out how you can contact these people, it will be in the description, like I said. All right. Well, like I said, thanks for coming in today. I really appreciate it. And this is another episode of We Talk Health.